very warm welcome to this webinar titled Country Signals What It Will Take to Deliver on UNGA and Jeddah Commitments. So, my name is Dr. Salman Kanar. I am the Senior Technical Advisor for React Africa, and I will be your moderator for today's session. Thank you very much for all for joining us. It's a wonderful to have such a diverse group of participants here. So today we are going to take a close look at what countries are actually doing in terms of translating the global AMR commitment, especially the UNGA political declaration and the Jeddah commitments into real as well as a measurable progress on the ground. Our focus is not just on what's working, but also on what struck and most importantly, what support countries actually need to move faster as well as further. So a few quick ground rules before we begin. So this session is being recorded to capture insights that will inform a cross-country brief. And in case if you have any questions, please post in the chat or raise your hands. And we will begin with a short poll and then move to quick lightning talks and then a panel discussion with our respective country focal points. So with that, let's get started with a quick pulse check poll. We would like to start by hearing from you what has been the biggest constraint this year in advancing your AMR work. Maybe you can choose from governance, financing or data or workforce or cross-sector coordination. You can post in the chat or if there is any other thought, you have 30 seconds to respond in the chat. So what has been the biggest constraint this year in advancing your AMR work? Yeah, interesting results coming. It seems governance and finance. Governance, lack of funding, lack of political will, limited funding, any other bottlenecks your country is facing in advancing your AMR work? So I think it seems governance and financing are still the most common bottleneck across regions, and that actually aligns well with today's focus area. Thank you all. This gives us a good sense of where we collectively stand. So let's move into the heart of today's session, our country lightning talks. We will hear from three countries, Rwanda, Senegal, and Tanzania. So each country will briefly share highlights from their recent tracks, class, or informed data, which will focusing on what's working in their country and what's the challenge and what support they need to keep momentum. And each speaker has around 10 minutes to present. So we will begin with Rwanda, focusing on governance and sustainable financing under the One Health platform. So Rwanda has made significant progress in strengthening its multi-sectoral coordination committee and also integrating AMR into the broader health security and One Health framework. And also the country's experience actually offers valuable lessons on how political commitment and also the structured financing can actually translate into measurable outcomes. So I now invite Dr. Noel Gahamani, who is a Rwandan molecular microbiologist and academic who currently serve as director of the microbiology unit at the National Reference Laboratory under the Rwanda Biomedical Center, as well as he is a lecturer in microbiology at the University of Rwanda. Over to you, Dr. Noel. Dr. Noel, you are muted.
Okay, yeah, thank you for having me. I'm going to share with you what Rwanda has made as a progress in MR surveillance, in governance, and yeah, recently received feedback from yeah WHO Afro region on the successful submission of our data to GLAS. So we are proud of where we are. It's not yet over, but yeah, we are on a good track. So you can confirm that you are seeing my presentation.
Yes.
Okay. Yeah, I'm Dr. Noel Gahamanyi, serving as the acting division manager of the National Reference Lab in Rwanda Biomedical Center, which is the implementing agency of the Ministry of Health, or in when it comes to the MR surveillance, even in policy implementation. So I was tasked to talk about the governance and coordination and also the financing lines. Um, Actually, we started this journey back since 2020 when we started with awareness campaigns, but we then moved to the actual correction of MR data. So for the National Action Plan, we had the first objective, uh, was about the MR awareness. And as we were inspired by the Global Glass, which had the five objectives in the NAP, each country was adjusting its own NAP. Ours, which we ended the last year, so we adopted the second NAP, National Action Plan on MR. But for the second one, now we added the fifth objective, which specifically was on the governance, because governance is the one that really drives the changes. You may have good system, but if the governance is not well functioning, it becomes an issue. So we emphasize on the governance as one of the strategies to drive forward the MR surveillance and awareness. How did this work? We set up the One Health multi-sectoral MR technical working group, which is one of the technical working group in One Health cluster. So it is reports under the Prime Minister's office. Then in the One Health Steering Committee, with the One Health multi-sectoral coordination mechanism, it has different technical working groups. One of them it is on MR. And also there was establishment of the One Health unit under Rwanda Biomedical Center. That One Health, it is the one that coordinates. We have different ministries, the Ministry of Agriculture, the Ministry of Environment, and also the Ministry of Health. Those ministries come together for the implementation of the One Health, but one of the activities being on MR. So at the Rwanda Biomedical Center, we have a unit which is in charge of implementation of the activities specified in the NAP. The statement is from our DG, Prof. Muvunyi, where he was recognizing the importance of One Health in driving forward the multi-sectoral coordination committee and the activities specified into the NAP. Yeah, how did we manage with the support from the React Africa? Yeah, we developed this 60th objective, which is specific on the governance. We even did it on the costing, on the activities from each sector, in human sector, animal, and also the environment. The financing lines, okay, Rwanda government has provided this budget, especially for bacteriology. Previously, we had only four laboratories that were actively doing bacteriology culture. And this even it's like across Africa where there was a report of MAP saying that only 1.3% of the labs among the 14 countries that were surveyed, only there was only 1.3% that could do the bacterial culture. So the same trend was in Rwanda. But in this year, now they are functional. We started equipping those laboratories. So 13 new laboratories have been launched that are doing bacterial culture, and they are spread throughout the country. So they help us to collect the data on the pathogens, the bacteria that are predominant, and also on their AST profiles. So they are across the country in all the provinces of the country. Also, we received the support from the WHO, World Health Organization, in terms of reagents, equipment, also the East African community, and also the Framing Fund. There is a grant that is being implemented in Rwanda, where Framing Fund is supporting the country on strengthening the surveillance in the human and also in the animal sector. Also, we recognize the support from XIHC, which when in 2022, 2023, really started strengthened the awareness, yeah, primarily among healthcare professionals. So they were trained on the issue of MR, on the AST, on the surveillance, on the interpretation of data, so on the One Health approach. So that really drives the Rwanda forward in the implementation and the revision of the NAP. There is also the PIH, Partners in Health, which currently supports the technical working group meetings and other activities. Like now, we are preparing the WOW, and PIH is playing a critical role. We have also the Pandemic Fund, which is supporting it to equip the laboratories in terms of equipment. The functioning of the multi-sectoral coordination committee, which drives drive delivery. We have the MR focal person that has been appointed. And also, as I mentioned, we have one health unit at Rwanda Biomedical Center. We have also technical working groups that one on humans, the other on the food, so that they can collaborate and have a global picture of MR in Rwanda. Also, as I mentioned previously, we had the training sessions using One Health approach. Even next week, we have a workshop on a training on data analysis, MR data analysis. After 2 weeks, we'll be having another training of those working in the bacteriology lab in both human and animal sector with the support from WHO. Also, we are preparing the One Health, the World Antimicrobial Resistance Awareness Week using this multi-sectoral coordinating committee. So, and the progress is good. The gaps mainly it's on the budget. Our NAP2 is around 40 billion Rwanda franc, which is around 29.6 million USD. It's not a small amount. So with each institution has a small budget, but with the input of partners, we are seeing how we can cover the whole budget. Also, staffing. The unit still has a few staff, like 3 staff. So to coordinate all the activities is not easy. So staffing would also be strengthened. Also, limited lab capacity. In the animal sector, there is one national lab, but there's a plan to have 5, one in each province. So for in environmental sector, we don't have any laboratory. So the M&E is also still in its infancy, where we are also getting support from the Fleming Fund. What brought the change we see is that the Rwanda Biomedical Center, which is the implementing agency of the Ministry of Health, took the lead and is coordinating the MSCC. Also, we have leaders who understand the MR issue, starting from our DG, the Director General, the head of department, even myself. We have expertise in microbiology and also in MR. Also having that one health unit which drives, and also having the focal person who is based at RBC. Also the support we received from the XIHC to improve first the awareness, and now we can go to the MR surveillance and data correction. Also the publication of the findings highlighting the issue, because when you don't have real data, we are basing on publications. But if you have now data, you can even influence policy. So that's what I had to share with you. What we plan next is to continue the implementation of the NAP because it was approved last year, so we are in implementation phase. Mobilize resource to support planned activities. Yeah, celebrate WOW 2025 from 18th to 24th November, and we already invitations have been sent, and we hope it to be vibrant. So, and the stakeholders from there, they can even get involved into the activities we plan. Strengthening the bacterial capacity in animal health and also environmental sectors, and also strengthening the data management. You may have data, but if you don't analyze and show the trends you want to achieve. So thank you for your kind attention.
Thank you very much, Dr. Noel, for that comprehensive and elaborative presentation. It's encouraging to see how Rwanda has institutionalized multi-sector coordination and now moving forward, looking forward to implement the second NAP and also moving towards sustainable financing and also the stronger accountability frameworks. So we will take questions for Rwanda along with those for Senegal and Tanzania towards the end of the session after all the 3 country presentations. So next,
Thank you.
we move to our next country presentations from Senegal. So it's my pleasure to invite Madam Fatau Sarabea, who has been instrumental in advancing agri-food stewardship and surveillance efforts in Senegal. She is the current Director General of the National Laboratory for Analysis and Control of Food and Non-Food Products at the Ministry of Industry and Trade of Senegal. So she will walk us through the progress the Senegal has made and also the persistent challenges in obtaining routine AMU data and the policy and the operational shifts. Madam, the floor is yours.
Euh, Merci de m'avoir invité à ce panel.
Thank you very much for having invited me to
Je
this
pense,
panel.
est-ce que vous
I
voyez le
think,
partage que
are
je suis
you
en train de
able to
faire?
see my screen?
Le
Are
partage
you
du
able to see
document?
my screen?
Ça vient, pas
Are
encore,
you
mais ça
able?
vient. Hmm.
Not
Vous
yet.
pouvez ouvrir le document,
Kindly
le
open your
diapo.
document.
Allô?
Yeah, the document is not
Allô?
opened yet.
Vous pouvez ouvrir le diapo, pas encore.
Est-ce que vous voyez la présentation?
Non,
C'est pas
non.
encore ouvert?
Ok, peut-être que Tembo peut, ou Khan peut présenter pour vous.
Dr.
Parce qu'on
Tembo,
voit. Oui,
would you kindly
À
assist
niveau
maybe to
3.
open? Let me check again.
Est-ce que c'est bon maintenant?
Ah oui, c'est bien. Ça marche. Vous pouvez
Oui.
mettre aussi le full screen.
Diapo.
Ouais.
C'est bon?
Parfait.
Bonjour tout le monde. Merci de
Good
m'avoir
morning,
invité
everyone.
pour
Good
ce
afternoon.
panel.
Thank you for having invited me
Donc,
to this
c'est
panel.
Madame Sarefa Toubey,
Madam
directrice
Sarif
générale
Toubey, I'm a
du
general
laboratoire national
director
d'analyse
of
et de
the
contrôle
National Laboratory of
des
Analysis
produits
and
alimentaires
Control of
du ministère de
Food
l'Industrie et du
Product at the
Commerce du
Ministry of
Sénégal.
Industry and Trade
Donc,
of
on peut dire que ce laboratoire
Senegal. So I
a
can say that
été
this
créé depuis
laboratory
1939.
was
Donc, nous sommes le seul
created
laboratoire
since
de contrôle des produits
1939. So we
alimentaires
are the
où on dit
only
que nous sommes le bras
national
technique
control laboratory.
du ministère de l'Industrie et du
So
Commerce,
we are now coming from the Ministry
qui
of
a au
Industry
niveau
and Trade,
du ministère
and at the
une direction du commerce
ministry
intérieur
level
qui octroie
with
tout ce qui est certificat
Interior
de
Commissarial
fabrication
certifying or what is
et de
being
mise en
uh,
vente des produits locaux
produced and
et
also
aussi qui
the
octroie
sales of
la
the
déclaration
local
d'importation
product
des
and
produits
also the declaration of
alimentaires pour tout ce qui est
export
produits
of food
alimentaires importés
stuff
avant la
for
mise sur le
I
marché
mean that is
euh,
important before being
du
put on
Sénégal.
the market in Senegal.
Donc, comme progrès,
So
on
as
peut
in
dire
terms of
que le
progress, we can
laboratoire
say that the laboratory
est désormais enrôlé pour la surveillance de la
is
rame
now doing the
des
surveillance
antimicrobiens
with
pour tout ce qui est agroalimentaire
antimicrobial,
grâce à des projets de
in
surveillance comme le
terms
Fleming
of
Fund.
so
Pour
we
la
have the
première
Fleming
phase,
Fund,
le
for
laboratoire
instance, for the first
physiquement
phase,
n'était pas enrôlé,
the
mais pour la deuxième phase, cette fois-ci,
laboratory, I mean, for
le
the second
laboratoire a
phase,
besoin de
I think the
personnes
laboratory
enrôlées dans la
is
surveillance
there in support in terms
et
of
on est dans
surveillance,
la surveillance active.
and we are in active
Cette
surveillance.
intégration représente
So this
avancée claire vers la
integration,
disponibilité de données nationales fiables
represent
dans le
the
secteur
availability of
agroalimentaire.
data in the
Comme
food
l'atout
and
pour remédier à une absence
in
de
terms
données
of
agroalimentaires
challenges.
dans les
So say that
plateformes de surveillance
there is a
régionales
lack
ou globales,
of
comme dû à des
data
défis d'ordre
in terms of
opérationnel et
RAM
financier.
because of operational and financial difficulties or
Comme solution
challenges.
politique et
As
opérationnelle,
a
nous avons
solution,
pensé que
so we thought that
il
it's
faut un
better
encadrement ciblé
to
et un soutien
target
technique
and
via le projet
have
Fleming Fund
technical support
qui va
via
agir
the Fleming Fund
comme un contrôle
project
sur
that
la
can act,
réglementation et un levier de
in terms
renforcement
of
des capacités initiales.
regulatory and also capacity
Comme
building.
besoin immédiat, c'est la
And so, as
sécurisation de
immediate
l'accès aux fonds
need, so they have the
à
security
l'équipement
of
de
the access
laboratoire
to funds,
pour tout ce qui serait de
to
maintenance
equip
et de double
laboratories in
d'outils
terms of maintenance and all
auraient
the
il faut assurer
tools,
la continuité du
and
rapportage de la
also,
surveillance de la rame
the regent in order to
Au
assure
niveau
the
du
continuity
laboratoire, nous avons mis
because in the
trois centres
laboratory we have
qui présentent
isolated,
un profil de
300
multirésistance et
strains
nous
that
avons des
have
problèmes pour
resistance, but
les
we have
identifier parce que
issues
nous
to
n'avons pas de
identify
galérie
them because
H.
we do not have
Donc,
adequate
on pense
tools.
aussi à l'établissement
So
d'un
we
des
think
protocoles
to
pour le partage
establish a protocol for the share
euh, de
mm,
données robustes, y
of
compris sécurité vie, puisque nous avons des
robust
laboratoires privés
data, including
entre
those
les
from
ministères
the
concernés avec
private
l'agriculture,
sector,
la
the
santé
Ministry of
et
Agriculture, the
l'environnement.
Ministry of Health and Environment.
Merci de votre attention.
Thank you very much for your kind attention. Thank you for your attention. I'm done. Were you able to follow my presentation?
Oui,
Are you able to hear
merci.
me?
Oui, we can hear you.
Les trois présentations.
Dr. Khan, over to you.
Yeah, thank you. So thank you so much, Madam Bay, for that insightful presentation, and it's inspiring to see how Senegal is moving, moving and strengthening the AMU data capture. So these are actually the critical lessons for regional cooperation and also for building a One Health driven response in the agri-food sector. So we were expecting to hear next from Tanzania, but the speaker is yet to join. So while we wait for her connection, let's move ahead with our panel discussion. So I will begin with the two panelists who have already presented, Rwanda and Senegal. And once the Tanzania colleague is able to join, we will bring her into the conversation. So as a reminder, so all the participants, they are welcome to post question in the chat, or you can actually raise your hand if you would like to share a short comment. So we will bring a few of those after the panel. With that, we now move to our panel discussion, continuing with the same speakers. So, Rwanda, let's start with you. So, what single authority or budget change would most accelerate the effectiveness of your multi-sectoral coordination committee in the next 12 months?
Okay, thank you, Khan. A single tweak would be like having a separate budget for the MSCC because so far each institution is planning on its own some activities that are related to the AMR and the implementation of the NAP on AMR. So the single twist will be having a budget that is centrally managed, saying we have these activities and they are planned accordingly. Because sometimes we may have different priorities, and in case there is like budget revision, the budget that was specific for AMR could be reduced depending on other emergencies. But if there is a separate budget managed by the MSCC, that could maybe help to implement the NAP as it was planned. Thank you.
Thank you very much, Dr. Noel. That's a very helpful perspective. So, before moving to the next panelist, so I can see two hands raised. One is from Papi Hichika. So, Papi Hichika, over to you. You can ask the question now. You can unmute and ask the question.
Merci beaucoup de la parole m'accorder. Je ne sais pas si vous m'entendez.
Thank you for giving me the floor. I hope you are able to listen to hear me.
Ok, merci.
Thank you.
Merci beaucoup. Je suis
Thank you
Papi
very much,
Achika,
Papi Ichika Semono.
microbiologiste
My name, I'm
depuis la région de
microbiologist
Kolwezi,
from
dans
the
la
city
province
of
de Lualaba,
Kolwezi in the Lualaba province,
démocratique du Congo.
Democratic Republic of Congo.
Ma question, je m'en veux
My
juste
question I would like to
demander
ask
en ce qui concerne les budgets
regarding
sur
the
la RAN.
budget on
Parce que
MR, because today, if I take the example of my country, we did not have an allocated budget exclusively for MR. And yet, this AMR, it's an issue, that affects the whole world, so it's because the microbes, do not need any passport to go and, to go and infect people in, at the international level. Now, my question I would like to ask, if a country does not have a specific budget for MR, and researchers, convene to produce data, quality data in order to put in place a report committee or the surveillance of MR at the regional, provincial level. Are they organizations that, can support those researchers, even though, yes, their specific country does not have any budget for them? Is there any, international organization that can support researchers in the surveillance against AMR? Thank you.
Khan, how many questions are we taking? Khan?
So maybe you can answer to Patrick.
Okay.
Yeah.
Okay. Maybe I can. Oh, Papi, do you also speak English or je dois te répondre en français?
Yes, I speak English also.
Ok, ok. Je parle les deux langues, mais parfois je peux manquer de vocabulaire parce que je n'utilise pas souvent. Mais je peux essayer premièrement en français.
So I can try first to answer you in French. Yes, there are international organizations that support researchers in different countries to implement their projects or their
policies.
or
For instance, I'm talking about beef
no,
farming fund. We got the grant. We had the XIHC, sometimes the WHO. So those international organizations will come in to support you into the implementation or even in purchasing the reagents, the consumables. But the first thing would be so the authorities in DRC would first show the need. Is it there? Then you support. It was somehow even the same sometimes back. We didn't have a clear budget on bacteriology. But since 2021, we're getting like 300 million Rwandan francs we specific for bacteriology because we're seeing people having the infections, bloodstream infections, urinary tract infections, and being given those antibiotics, but without lab results. So if you show that there is a need, the government can start with a small budget, then the partner will come in showing it after seeing that you have an interest, you have tried your best, then they can complement. That's what I can tell. Thank you.
Thank you, Dr. Noel. So now we will move to Senegal. Madam Fatou Sarabeye. So, what two changes would most quickly improve routine animal sector AMU reporting within next 12 months?
J'ai pas bien entendu.
would you kindly repeat your question, please?
C'est pour le financement?
No. Would you kindly repeat your question?
Maybe you can repeat for her.
Can you
Yeah,
please
so-
repeat the
So,
question? Thank you.
what two changes would most quickly improve routine animal sector AMU reporting within the next 12 months?
I'm sorry. I'm sorry. I cannot hear him properly. I'm sorry. I couldn't exactly. It's kind of cutting a little bit. I can't hear the question properly.
Okay, maybe you can repeat so that I can translate maybe for her.
Yeah.
Okay, so what two changes would most quickly improve routine
Ça
animal
vient
sector
pas.
AMU reporting within the next 12 months?
Ok. Madame Saré, il dit quels sont les deux changements principaux que vous pouvez faire pour augmenter le reportage des données dans le secteur animal pour l'usage des antimicrobiens.
Allô, je vous entends plus.
Oops.
I think she has an issue of the connection.
I think she
Est-ce que
may
je
have
peux
a
répondre pour
problem.
elle?
Oui.
So,
Mais peut-être
vous-
qu'elle a des problèmes de réseau.
Madame, est-ce que vous nous entendez?
Oui, je vous entends maintenant, oui.
Voilà, la question était de savoir quels sont les changements que vous voulez implémenter dans le secteur agroalimentaire au Sénégal.
Oui. Donc, ce que nous voulons implanter au niveau
Okay,
de
so what we
l'industrie
would like
alimentaire,
to
c'est que
implement
avant,
in
pour
the agro
l'agroalimentaire, on ne gardait
sector,
pas les souches pathogènes. On se disait qu'on n'en avait
so
pas
we have
besoin
the
puisque
pathogens. I
c'est de
think we
voir si le
didn't
produit
need
est apte à
that.
la
It
consommation
was
ou non.
to
Mais
see,
depuis quelques temps, quelques années,
but
les souches sont
after
gardées
some
pour
time,
avoir
we are
la
keeping the
résistance
strains in order
et
to have the resistance.
quand il y a une
And
circulation
see if
de
there
choses
is
résistantes, qu'on
a
puisse voir si ça n'a pas
circulation of
d'implantation.
resistant strains.
Donc,
So if
ce
that
que
is not
nous,
coming from the
ce qu'on
food.
prévoit de faire,
Uh,
c'est
so
d'avoir
what
un budget
we intend to do is to have a
de l'État
budget,
pour la surveillance de la rame, pour que ça soit pérenne.
for the
Parce
surveillance, and this
qu'actuellement, on
should be
a des
sustainable
financements
because
comme le
for now
projet
we have
Fleming
some
Fund
financing,
qui
like the Fleming Fund project that
qui renforce les capacités des
is
différents laboratoires
building the
agroalimentaires qui
capacity
sont
of
en
different
indépendance surveillance.
laboratories.
Mais ce qu'on voudrait, c'est la
But what we
pérennisation
would like is, after the
de la pérennisation
usage,
d'un budget
I
concernant
mean,
la surveillance de la rame
the
dans
sustainability of the
l'agroalimentaire.
project into the agro food industry.
Thank you, madam. So, Dr. Noel, would you like to translate her answer for the participants?
Bah,
The
peut-être
interpreter is
si vous avez
there.
suivi, vous pouvez faire la traduction?
Allô?
I did the
Nous vous
interpretation. The
entendons effectivement,
interpreter,
mais j'ai comme
the
l'impression la
interpreter is
dame
there.
a du mal à vous entendre, vous là-bas, l'interprète.
So no,
Je
no,
dis si vous avez
elle-
suivi ce que madame a dit, la réponse. Vous pouvez faire la traduction pour que Khan entende. Il n'entend pas le français.
Okay.
Madame, est-ce que vous entendez bien l'interprète ou bien vous m'entendez, moi, papy?
Avec l'interprète, il y a des coupures, mais avec Papy, j'ai tout entendu. Je ne sais pas, est-ce que vous avez entendu la réponse que j'ai donnée ou non?
Ah bon, moi, Khan veut que vous répétiez deux points. Je peux faire la traduction pour lui. Si vous pouvez répéter.
Si on
Il
peut-
vous a demandé de répéter pour qu'on fasse la retransmission ou bien l'interprète en anglais, s'il vous plaît, madame.
so I think Dr. Khan
D'accord.
has
Maintenant, je
requested you
disais
to
que
repeat. So I
nous,
was saying
ce
that
qu'on veut, c'est d'avoir un
what
budget
we
de l'État
want is to have a budget from the
sur
government
la surveillance
on
au
the
niveau du
surveillance
système
at the
agroalimentaire.
level
Parce que
of
c'est vrai que
the
nous avons
agro-food
nous
industry,
avons une
because
subvention, nous avons des
we
appuis
have, some tools
dans les projets comme le Fleming
in
Fund.
the
Mais
project,
pour que
like
ça soit
the
pérenne,
Fleming
il faut
Fund.
que
In order for it to be
les États
sustainable, the
puissent
state, the government
octroyer
has
un
to,
budget pour la surveillance de la rame
support,
au niveau de
a
l'agroalimentaire.
budget and the surveillance of
C'est-à-dire
these,
d'appuyer les
you know,
laboratoires en renforcement des
agribusiness to
capacités
support
d'équipement,
laboratories
de
to
formation,
capacity, build the
puisque j'ai dit
capacity and
qu'actuellement, nous avons isolé
do the
300
trainings
souches
because we need
pathogènes
300 strains and
qui
the
ont un
pathogens
profil mutualisant,
that
mais il
have
reste
a resistance,
l'identification parce qu'il manque
but what
d'abord
remains is
l'identification
the
comme les Fleming.
identification. Yeah.
Est-ce que vous avez bien
And
entendu?
so I hope
Oui,
that
merci
you have
beaucoup.
understood.
Khan, she said
Thank
that
you,
there are
Dr.
two things.
Khan.
First of all, it is
So
to advocate for budget, the government budget on the surveillance in food and agriculture, so that there is sustainability of the program. Because if it's like the budget from the funder may end, sustainability would be possible if government inject in some funds. The second one is about the capacity building, especially in the equipment and training for the staff. Thank you.
Thank you, Dr. Noel, and thank you, Madam Sarah. So let's move to our second round of question. So before that, if there is any questions from the participants, you can post it in the chat or you can raise your hand. So moving to the Rwanda, so how do you plan to track the performance of your coordination mechanisms, perhaps through quarterly key performance indicators or progress map makers in order to ensure accountability and sustained momentum?
Okay, thank you. First of all, it's through the technical working group meetings. They're supposed to be quarterly. Sometimes we may have them maybe twice per year, depending on the priorities, having a common understanding on the planning timing for the multi-sectoral team. So the technical group, that's one. The second one is like a joint surveillance report. For instance, now with the support from the Fleming Fund, we are collecting data from the hospitals. So that's those kind of reports could help. Lastly, it's about the hospitals submitting their data. We started, it's not yet really operational, but we started requesting the hospitals to submit their pathogens so that we can, and their resistance profile they get, so that we can check, do the quality control. So we will confirm what they got if it is really working. So those are the three elements I can mention. Thank you.
Thank you. Thank you very much for very clear insights on how performance tracking can strengthen the coordination. Now we will move to Senegal again. Madam Fatau, which codex consistent practices do you believe are most feasible to scale nationally this year? Madam, you are muted. Maybe I can repeat the question once more.
Yes, please. You can repeat the question, please.
Maybe you can repeat.
So, which codex consistent practices do you believe are most feasible to scale nationally this year?
Which practice what? The first word I didn't get. Which?
Codex consistent practices.
Product.
Yeah.
Product consistency practices.
Yeah.
Maybe it's not clear to me to
Codex.
translate.
Codex. Yeah.
CODEX. Codex.
Codex. Codex. Madame Saré, vous êtes là?
Est-ce qu'il peut écrire sa question?
Okay.
Is it possible maybe to type, maybe just to type your question in the chat box? If you can type it in the chat box. Are you able to type your question in the chat box, please, Dr. Khan?
Yeah. It's already in the chat.
Okay. Which codex
Madame, vous la voyez? Il demande quelles sont les pratiques consistantes qui sont faisables.
Oui, au niveau du codex, il y a des directives sur la surveillance de la rame. Et c'est ça, oui, c'est quelles pratiques conformes au codex sont les plus faciles à mettre en œuvre à l'échelle nationale cette année. C'est de prendre les lignes directives du codex.
So you have to take a directive from Codex, and we have to contextualize that with regard to our country, I mean Senegal. As for the surveillance, we have a guide, a surveillance guide that we have developed, and this guide we took.
On avait pris
So we took the the guidelines of a codex that we integrated into the guide in the enrollment of the food sector in the surveillance.
Est-ce que vous m'avez entendu?
Have
Ou vous
you
voulez que...
heard my response,
Nous
or
l'avons
you would
entendu. Je ne
like
sais pas de
me
votre côté
to
s'ils ont
repeat?
entendu ou pas.
Dr. Khan, have you heard
D'accord.
the answer?
Yes, yes, yes. Thank you. Thank you. Madam, thank you, Senegal. Thank you, Madam, for the insight. We now open the floor to our participant, and there is already a question from DRC. Like, can I also share my experience of the DRC, but with my own this question from there is a question from Pappy. Pappy, you want to ask the question directly to the panelist? Maybe you can unmute and ask.
Non, je voulais juste demander si
I
serait-il aussi
wanted to ask
nécessaire
if
de
it would be
partager
necessary
mon
to
expérience ici
share
en
my
ce que je fais
experience
en
of what
RDC
I do
malgré
in
ces
the
difficultés
DRC,
financement propres. Est-ce que
despite
c'est faisable, c'est
lacking the
possible que je
financing.
partage cette
Is it
expérience?
possible that I share my experience?
Yes.
Oui.
Oui, ça va, vous pouvez continuer.
Ok, merci beaucoup
Thank you
de la parole
very much,
accordée. Au
for
fait,
the giving me the floor.
moi, je suis
So for
parti du
me,
fait que depuis que j'ai commencé à
so from the
travailler dans
time I
l'acteur
started
humain,
working in the human
j'ai
sector,
constaté
I
que
noticed
bon nombre
that
de
many
bactéries
of the
étaient
bacteria,
graisseux. Donc, étaient des
uh,
bactéries sécrétrices de
where
gaz
donc
à spectre
the
étendu dans
bacteria,
90%, je peux le dire.
bacteria, that's why I would
Alors,
say
cela
that
avait
maybe
tiré avait attiré mon
90%. So
attention
that
et
attracted my
je me suis mis
attention,
à
and
collecter
I started to collect
les souches de différence de plutôt
the
de
strengths from
quatre
different
hôpitaux
the
généraux de la
four
province
hospitals, general
pour
hospitals of the
arriver à
province,
étudier les
in
profils de
order to
résistance des
study,
bactéries qui
the
circulent dans notre région.
resistance of
Et
bacteria
je me
that
suis
are
rendu compte que
circulating and moving in our region.
sur 100%,
I
il y avait
noticed that on
38%
100%,
des
there were
bactéries qui
38%
sécrétaient
of
des bêta-lactomases
bacteria
à spectre
that were
étendu et
secreting, the
leur profil de
balactomase,
résistance
and
était avait une bonne
the
avait
resistance
une bonne sensibilité
had a
à la
good
nitrofurantoïne,
sensitivity
hormis les
to
carbapenémases que j'ai
mitrofurantoin
développées. Et j'ai
that
pris
are
les
put
mêmes
by the
souches-là.
side.
Il
So
y
I
avait
took the same
81
strain.
souches.
There
Je
was
les ai
81
envoyées en
strains.
Europe,
I
à
sent them in
l'Université catholique de
Europe
Louvain, pour
to
faire le
the
séquençage.
Catholic
On a fait d'abord la
University
détection des
to
gènes.
do the
On a retrouvé les gènes de
sequencing. The
résistance
first
de la
checked on the
place
genes,
et on
so
a
yeah,
commencé à faire le
and we
séquençage.
started doing the
Mais
sequencing.
malheureusement, une souche m'a
Unfortunately,
coûté au moins
one
150
strain
euros. Et cela,
costed me
c'est
about
sur du
150
financement propre,
euros,
sans
and I was doing that from my
accompagnement, ni
own,
budget de l'État, ni
financing, and
un organisme
none of
international qui m'accompagne.
budget
Donc,
from
je
the
paie ça, tout ça sur
state. So
financement
I paid
propre.
all
Pourquoi je
that
fais ça? Parce
by
que
myself. Why did I
dans ma
do so?
province, il n'y a que
It's
moi qui
because in
fais
my
la
province, I'm the only
bactériologie.
one
Tous les
who's
hôpitaux
doing the
ne font pas la
bacteriology. All
bactériologie.
the hospitals
Alors,
are not doing
la
that.
semaine
So
mondiale ici
and
qui vont
the,
être à l'horizon,
as
d'ici
you
le
know,
18 novembre, nous allons
World
célébrer
Week
la
that
semaine
we are now
mondiale de
going
la
to
sensibilisation.
celebrate
J'ai
the
déjà convoqué tous
sensitization.
les
I've
médecins,
already
toutes les
invited all
corporations de santé,
the
ordre des
doctors
médecins,
in
ordre
all,
des infirmiers, ordre des
hospitals,
pharmaciens,
the
ordre des médecins
nurses,
vétérinaires, voire même
pharmacists,
des agronomes,
veterinary
ingénieurs agronomes,
agronomists, and so
juste pour
on. I've
partager avec
invited
eux
them, to share with them.
les données que j'ai eu à
The data
réaliser
that I
pendant les
received during
quatre dernières
the
années,
last
afin
4 years of my
d'améliorer les protocoles
studies,
de
so
la
that
prise en charge
we
des
could
infections
improve the
bactériennes
protocol
pour
of,
peut-être arriver
the
à
bacterial
pratiquer
infections, so that we can reach to
l'antibiothérapie
practice
probabiliste
the
en se basant sur les données locales de notre
biotherapy
province
to
qui
be
là-bas de
based
la
on the
meilleure écologie
local
pour aider
data
les
in the
cliniciens
ecology in
à
order
rationaliser au
to
mieux leurs
help,
prescriptions
the
pour
clinicians
arriver à
to
éviter
rationalize whatever they do,
l'émergence de
and
la
if
résistance aux antimicrobiens dans notre
avoid the
écologie.
emergence
Voilà
of
du moins
antimicrobial issues.
l'expérience
So this is the
que j'ai sur ces
experience that
derniers
I
temps, malgré
acquired
que sur fonds propres,
in
sur financement
my
propre,
city by financing everything myself. So through you, if you could assist me to contact, some funders and see on how to assist and put in place a committee, because I am the one, lecturing at the university, microbiology and MR. Thank you.
Thank you, Papi Hichika. So now our third presenter, she's online now. So I would like to invite Emiliana and Francis to share Tanzania's experiences, particularly how inform and related initiatives are being used to inform targeted interventions in the animal health sector. So over to you, Emiliana Francis.
Oh, okay. Thank you. Thank you, everyone. Good evening, good afternoon. My name is Emiliana from Ministry of Health, Tanzania. I'll just take you through on the key achievement that we have been done into contribution of the global target of 10% reduction of the AMR by 2030. So we have strengthened our lab capacity to inform the rational use of antimicrobials. Through the strengthening of the lab capacity, we have seen the key achievement like reduction in antimicrobial national antimicrobial consumption from 129 in the year of 2017 when we started implementing the National Action Plan to certain numbers of DDD, to 13 numbers of DDD for year 2024. So this is a remarkable achievement. As you can see, there is a significant reduction of antimicrobial use, especially for the group of watch and the group of reserve, which are the key group that we are monitoring. But also we have been increased the use of the access to antibiotics to more than 60%. And now we are approaching the targets which were set by the WHO of at least 70%. Also the data that we got from AMR, they have helped the country to provide the evidence for guideline review in human and the animal sector. For example, from the AMR surveillance data, we were able to review or to develop the national antibiotic aware categorization, the key document that guide the rational use of antimicrobial in the country. So all the evidence that we used in development of that guide, we had it from our own AMR surveillance data. So also the AMR surveillance data, both from animal and human sector, informed the review of the standard treatment guideline for both in human and the animal sectors. So you can see it is a really good practice because from the beginning where we started monitoring the antimicrobial consumption and AMR surveillance, we noticed that through the surveillance process, we noticed that there are key antimicrobials like colistin. For us, we regard in the animal sector, we regard as a reserve group. But for animal sector, they are widely used in treating different kind of disease, especially in pigs. So you can see from the data that we got, they informed the police of reviewing the standard treatment guideline for animal sector, rationalizing on the way how they can treat different infection on different types of the animals that they are raising. So ultimately, the colistin were banned in human in animal sector. So it remained only in the animal guideline. Another key achievement is a reduction of AMR association death by 14%. When you see the AMR association deaths for 2017 up to 2024, you can see there is a reduction of 14% in a country wide. So this is the key achievement that has been done, and these are contributing to reduction of the 10% death in 10% deaths on the global AMR death by 2024. But also there have been a key achievement in increasing of the AMR surveillance data and AMR submission data from 2017 to 2024. We have the increase by 83%. So you can see below the graph where we started, and now we are having a key achievement on this area. Also, another key achievement is on the AMR data sharing platform. We have established One Health centralized data sharing center so that we can exchange information and within and across sector to know how serious the burden of the AMR is in each sector and which step to take to contain the AMR together. But also we have been supporting the national AMR coordination committees for AMR for high-level AMR discussion and decision making. When you can see the major achievements on the scores on 2016, before starting the implementation of National Action Plan in 2023, this is a JE score. You can see there is a remarkable achievement in different AMR indicators, this indicating that we are really progressing very well toward the global targets of reducing 10% of AMR death. Another key achievement is the government ownership, whereby most of the program, the AMR program, surveillance, stewardship, IPC awareness, they are well owned by the government in terms of knowledge and the skills. Another key achievement is on political commitment. We are having a strong political commitment in our country, and this has helped us a lot in advocating resources for implementation of the National Action Plan. And also this political commitment has been fostering local, regional, and international collaboration toward reduction of the AMR burden. Thank you. I submit over to you.
Thank you very much, Emiliana, for that excellent presentation. So these lessons is really valuable for other countries, especially exploring integrated AMU, AMC surveillance models. So if you have, so to the audience, if you have any questions or reflections to Emiliana, please go ahead and post them in the chat box, or if you would like to speak directly, you can raise your hand and we will invite you to come in. So maybe waiting for the questions from the panelist, sorry, from the audience, maybe I can actually begin. So to Emiliana, what realistic reduction in antimicrobial use do you think can be achieved by 2026? And what kind of enablers or partnerships would help you get there?
Okay, thank you. As you have seen that there is a remarkable reduction from 120 to 13 by just 5 years. Maybe we are expecting in 2026, maybe on 25th, maybe we will be having we'll be counting the national consumption DDD of less than 10%, less than 10. As you can see, the trend is very well convincing. And the enabler of these achievements is to have a strong political commitments on the AMR implementation, also having a strong governance and the coordination of the AMR activities across and within sectors, and having a strong collaboration, a One Health collaboration between sectors. As you have seen in my presentation, I said we are doing, like, for example, the monitoring. We are doing the monitoring together. This the particular sector, maybe for human sector, is doing the monitoring, and the particular sector for animal sector also doing the monitoring for consumption of antimicrobials. And we together see and discuss on the data and the findings, and then we come up with the togetherness of the we come up with the common agreed conclusion on the gaps and challenges that we find on those data. So the communication has been our cornerstone for making the success implementation of this key achievement of the AMR, but also the implementation of the National Action Plan on AMR. Thank you.
Thank you very much, Emiliana, for highlighting those very valid points. Like we need actually stronger governance, multi-sectoral coordination, as well as political will, which is a real enabler, which is needed to achieve it by 2026. Excellent. Thank you for highlighting it. I don't see any questions from participants so far. Maybe we can go to the another question to Emiliana. So, why do you see the best opportunities for public-private collaboration to accelerate responsible antimicrobial use without affecting livelihoods?
Thank you. We in Tanzania, we have seen a great opportunities of having the public-private partnership in implementing the National Action Plan. And we actually realizing this when we did a baseline survey in some few private hospitals on the antimicrobial use survey using the point prevalence survey. So we found that the private hospitals antibiotics are being utilized more in private hospitals compared to public. So what we did, we formed this technical working group, the National Technical Working Group, and some of the leaders who are leading the private sector in terms of the public health are the members of the national technical working groups on different technical working group like stewardship, IPC, surveillance. So for any intervention that we are doing, we also expand, or we scale up to the private sectors. So even for them, because they have money, they don't even need a government money. So they do for their own available resources. What we do, we provide the capacity for them, we provide the tools and other materials, so they expand the scope. So through that, we have been seeing that the private sector has been helping us a lot in implementing the National Action Plan with zero cost. So looking on the angle of the pharmaceutical manufacturers, we have integrated some of the stewardship program in pharmaceutical manufacturers. And like the inspections and having the same inspection of different regulators, like those who are like regulators who are from animal sector, regulators who are from human sector. When they are going to inspect these pharmaceutical manufacturers, they go together, the environmental, and they do a joint inspection, and also the finding, they just bring the finding to the technical working group for discussion and to take action on it. So this is how we have been engaging the private to make sure that we accelerate the implementation of the National Action Plan in the country. Thank you.
Thank you, Emiliana, for highlighting the opportunities for public-private collaboration to accelerate the responsible antimicrobial use. So we have a question from Babakar and I to Madam Sarai. So the question is how to organize to empower local French-speaking West African economic actors in rivers and streams in a RAN. So Babakar, is it RAM or AMR?
It's AMR. It's RAM for short in French.
Okay. So over to you, Madam Sarah.
Oui.
Yeah. So the question is how to organize to empower local French-speaking West African economic actors in rivers and streams in AMR. I just posted the question in the chat.
Madame, est-ce que vous avez compris la question, s'il vous plaît?
I think
Moi, je pense que c'est pas un problème
For
de
me,
capacité, c'est un
I
problème de
think it's not
sensibilisation.
just not a problem of
Il faut
capacity, it's a
sensibiliser les
sensitization. We have
autorités locaux
to sensitize the
qui travaillent dans les rivières et
local
les fleuves
people that are
pour
working in the rivers,
ils ne doivent pas utiliser peut-être
so they shouldn't
d'antimicrobiens
use
pour les pesticides et les reverser dans les
antimicrobials
fleuves ou dans les
and
rivières parce
to
que ça
pour
va
that
créer
into the
des
rivers
résistances.
because
On peut
that
aussi
will
avoir
create
des pesticides ou
resistance.
des résidus dans les rivières.
So there can
Donc, je
be a
pense que c'est une
residue or
sensibilisation qu'il faut faire
pesticides. So
au
we
niveau de
have to
ces acteurs-là.
sensitize the people, not to do that into the rivers. So I think that's the answer that I can give. Thank you.
Thank you, Madam Sarah. So before, so is there any other question from the panelist? If you have any questions, you can post it in the Q&A box, and if you would like to speak directly to the panelist, you can raise your hand. We will invite you to come in. So maybe waiting for the questions. Maybe I can actually ask one more question to all the panelists. So if you could actually name just one practical action that would make the biggest difference for your country's AMR progress in the next 12 months, what would it be? Maybe we can start with Tanzania.
Sorry, can you come again? I didn't catch you clear.
So, if you could name just one practical action that would make the biggest difference for your country's AMR progress in the next 12 months, what would it be?
Thank you. I would just say it is political commitment on the AMR action because everything is politics. If we really want this African region to excel this intervention to further step, the high level or high political leaders must get to this approach where we are going to. We need to communicate, to synthesize the AMR information in the way that they can understand and address that in the way that they can touch their political issues. So, in summary, we should focus on political commitment. Thank you.
Thank you, Emiliana, for highlighting the political commitment, which is needed for the next coming 12 months to make the biggest difference in terms of the country's AMR progress. Maybe we can hear from Dr. Noel. So, Dr. Noel, if you could just name one practical action. Over.
Okay, thank you. One practical action is to have regular technical working group meetings because we are still struggling to have them regularly. So having them regularly, that would help even to assess the progress, see the gaps, and even propose the way forward. Thank you.
Thank you, Dr. Noel. We can hear from Madam Sade. Madam Sade, uh, if you could name just one practical action that would make the biggest difference for your country's AMR progress, what would it be?
Madame Sarès,
L'action
si
que
vous
je
avez suivi.
vais
Ok,
demander, c'est de
continuez.
capaciter les laboratoires
Donc, to
alimentaires.
give
La
a
distance se fait
capacity
au niveau
to
de la
a
santé et
food
la
laboratory because
Maintenant,
everything,
ce
you
qui
know,
reste,
start
c'est
from
l'environnement.
the animal,
C'est de capaciter les
health.
laboratoires
So you need
pour qu'ils puissent au
to
moins donner des
capacity
résultats
building the
qu'on puisse faire,
laboratories so that can give us
enregistrer,
a
qu'on puisse
result
avoir des
that
données sur
can have
l'agroalimentaire,
a data.
sur la
Uh,
surveillance de la femme. C'est ça qui
or-
va faire la
so
différence
I
parce
think this
qu'actuellement,
is
on n'a
what
pas de
can
données
bring the difference because for now we
agroalimentaires,
do not
de
have
fiches agroalimentaires
data,
sur la femme.
the
Donc, je pense qu'il
strengths,
faudra capaciter les laboratoires pour qu'ils
food. So
puissent
we need
avoir des données fiables
to give the
à
capacity
mettre
building to reinforce
comment
laboratories, so that
pour la surveillance de la femme sur
so
plateforme
that
comme
the
agri-food.
surveillance of AMR, that could be strengthened. Thank you.
Thank you very much, Madam
Est-ce
Sade.
que vous m'avez entendu? Je pense que ça se coupe.
Yeah. Thank
Oui,
you.
oui, oui. Nous avons suivi. Vous avez parlé de la capacité des laboratoires pour que vous ayez des données.
Oui,
Thank
des
you.
données sur l'agroalimentaire. Merci.
Thank you, all the panelists, for your thoughtful engagement. It's been a really dynamic discussion. So, as we close, let me take a moment to summarize three important key takeaways from today's discussion. So, first, countries are really progressing, but unevenly across AMR pillars, and also the gap between commitment and capacity remains wide. And secondly, sustainable financing, strong governance, a strong laboratory and surveillance and data system remain the critical levers to deliver on the UNGA and Jeddah priorities. And thirdly, collaboration means across ministries, sectors, as well as the partners must be both institutionalized as well as incentivized if you want to see lasting impact. And the insights from today's discussion will contribute to a cross-country brief summarizing needs as well as the opportunity to fast track AMR progress by 2030. So, on behalf of the organizers and the panelists, thank you all for your participation and active engagement. Have a wonderful day, and let's keep the momentum going beyond this conversation. Thank you very much.